ഒരുപാട് സ്റ്റാർട്ടപ്പുകൾ ഈ ദിവസങ്ങളിലുള്ള കൂടെ കടന്നുപോയി. അങ്ങനെ സ്വപ്നങ്ങളുടെ ഒരു അവസാനത്തെ ദിവസം ഇന്ന് ഈ കോൺഫറൻസിൻ്റെ എത്തിയിരിക്കുകയാണ്. ഐ എം ജസ്റ്റ് ടോക്കിംഗ് ഇൻ മലയാളം ഫോർ 1 minute. സോ എപ്പോഴും ഹെൽത്ത് നമുക്കൊരു ലാസ്റ്റ് പ്രയോറിറ്റി ആയിട്ടാണ് വെച്ചിരിക്കുന്നത്. അപ്പം ഇന്ന് ലാസ്റ്റ് ടോക്ക് ഞങ്ങളുടെ വന്നതിന് ഞങ്ങൾക്ക് വളരെ സന്തോഷമുണ്ട്. ബിക്കോസ് ഹെൽത്ത്, ഈവൻ ദോ ഇറ്റ് ഈസ് ദ ലാസ്റ്റ് പ്രയോറിറ്റി ഫോർ മെനി പീപ്പിൾ, ഇറ്റ് റിക്വയർഡ് ദി ഫസ്റ്റ് പ്രയോറിറ്റി ഇൻ അവർ ലൈഫ്. അപ്പോൾ എനിക്ക് ലാസ്റ്റിൽ നിന്ന് കയറി വന്ന ഒരാളാണ് ഞാൻ സ്റ്റാർട്ടപ്പിൽ. പല സമയത്തും പല പരാജയങ്ങളിൽ കൂടെയും സ്റ്റാർട്ടപ്പ് ബിൽഡ് ചെയ്ത് ഇവിടം വരെ എത്തിയ ഒരാളാണ്. അപ്പം ഐ എം ജസ്റ്റ് ഗിവിങ് എ സ്മോൾ ഇൻട്രൊഡക്ഷൻ അബൌട്ട് മൈസെൽഫ്. ഐ എം സെനു. ഐ സ്റ്റാർട്ടഡ് മൈ കമ്പനി 3 years before in Kerala Startup Mission, Kochi. I started my company for 2 reasons. One, I lost one of my very close friend, which is 10 years younger than me, due to a massive cardiac arrest. Just because he does not know what is happening inside of him. And my father, he also got a massive brain stroke, just because he was not continuously following what doctor has told him to follow. So this is not the and one among another story in India. This is the story of most of the people. The healthcare is broken. Healthcare does not have any transparency. Healthcare is not affordable. ഈ കഥകൾ എല്ലാവരും കേട്ടിട്ടുണ്ട്. Healthcare, many people are just going with that. So today's conversation, even though it is a panel discussion, we are trying to make it a more conversation, more informal conversation. Like, we want to hear the perspective from their side. And I have 2 amazing friends, Bhavachod, who started a company in Bangalore making healthcare accessible, the primary care accessible for all the people in India. So they are currently having 12 clinics in Bangalore and expanding massively in India right now. And Dr. Abel, one of my colleague, we both worked in Apollo Hospital, and he is right now continuing the journey in the industry, and he is currently the CEO of Apollo Hospitals in Kochi. So once again, I am welcoming both of you to Kerala. I think especially Bhavachud, I am helping. You are driving all the way from Bangalore to Vagamon, or Vagamon to Trivandrum right now. So let's start. As I said, look, for me, I think the healthcare is going through a massive change for the next 5 years. The way which is going right now might not be, even in US, I have read an article right now, 1 in 5 people already shifting their access to ChatGPT more before going to a doctor right now. Even there are people in US, they started calling ambulance by getting an answer from ChatGPT that it is saying that this is your health today. It was said, earlier it was 2-way communication with patient and doctor. I think it is going for a 3-way communication. Patient, ChatGPT and doctor. They will go to ChatGPT first and upload all the report and try to see that what ChatGPT is saying, and then go to the doctor and ask what is it going. So this is going to be a massive shift is coming in, and I personally believe next 5 years, everyone in your hand will have a AI doctor with you, where you will be asking everything to that and getting clarity. So that is the shift in healthcare, what we are seeing it. So the first question of course, to Bhavachud, you are making the healthcare accessible for the middle class people of India, making it affordable, and everyone want to listen your story. Why did you start, first of all, and what motivated you to start this clinic journey?
Thank you, and thank you for having me in Kerala. As he said, I first went to Vagamon for a wedding, and then we came all the way here to Kovalam. So thank you for having me here. But I think what Senu brought up is a very important question on why will anybody, for that matter, right, start in healthcare? Because healthcare is one of those areas, one of those fields which is extremely patient. I mean, if like when I was fresh out of my college, I mean, I would have never thought that the kind of amount of hard work and persistence that will go into like building this. So my journey starts in Assam. So I'm brought up in Assam, a 3rd generation Sikh who's born and brought up in Assam. And then from there I went to study in IIT Roorkee. I was a geologist slash geophysicist. We call them geoscience people. So I studied geoscience and then joined Royal Dutch Shell as an exploration and production geoscientist. Worked there for 4.5 years before starting clinic. Now imagine there is this man, 50-year-old, 3 kids, in interiors of Assam, like not even like almost like a tier 4 town, and something as small as diabetes became a life-threatening chronic kidney disease for them. And the wife had no understanding what to do, what not to do. She's a simple housewife. She took this man to Chennai, where they were admitted in Apollo hospitals actually. And imagine a chronic kidney disease patient doing dialysis, waiting for a transplant for 8 months in Apollo. Like, it drained the entire savings of the family. The woman sold her gold, whatever land they had, because there was no health insurance to protect them at that point in time. So now what happens is that this man was my father and this woman was my mother, who went through all that they had to go through. I don't come from privilege, so I had to work to be able to have a corpus to start this company. And that's how my journey into healthcare began. I lost my father, as Senu also had said, that there was something very personal that motivates you to keep going every day. Otherwise, this is a very hard journey to take, to change healthcare from scratch. Because if you have to think about it, every sector that you have any sort of contact with today has been impacted with technology, but healthcare is still the way it was in 1800s. There was some doctor, you would go to them, they would give you some medicine. Like, very few fundamental changes have happened in healthcare, and I think that was the motivation to start clinic, to see how we could reimagine healthcare for a very large population of this country. So we started with combining first line care and health insurance to create the most affordable membership that this country ever has. So you pay as low as 200 to 500 rupees per month and your entire care is cashless. So that is what we began, and we started by delivering it through our own clinics. So as Senu mentioned, we had 12 clinics in Bangalore, and now we are expanding rapidly through other geographies in this country. Hopefully we'll be in Kerala soon. So that's the journey, that was the motivation, but very much glued to the mission of making sure that everybody has the right kind of healthcare that they deserve.
Absolutely, absolutely. Look, India, if you see, 66% of people are dying just because of the lifestyle disease. And if the AI and the healthcare companies or startups can help to find out that earlier, it is preventable. We can reduce heart attack, we can reduce diabetes, all this can be reduced. People are taking privilege that, okay, this is my body, I know everything about me, I can continue. And we as founders, we believe that we want to change it. In our generation, we want to see that when you can get a 10-minute milk packet, and how can you get access to healthcare as simple as it is? And that's the mission on we are. I think our generation will not say healthcare is broken, and we will be able to change it. Over to Dr. Abel. Amazing that you running an amazing brand hospitals. So digital hospital is a word which was buzzing around. What practically you mean on the floor, the digital hospital means?
Thank you for having me over. I'm Dr. Abel George. I work as a CEO of Apollo Adlex Hospital, which is part of the Apollo Group of Hospitals network, the largest private healthcare provider in India. When you talk about digital hospital, for me, a true digital hospital, it makes sense when there is a marked difference in the life of a patient. Because when you talk about hospitals, the end result is what we see if there is a marked change in the life of every patient that comes. So now, when I talk about patients, I can maybe divide it into two. That is the service part of it and the clinical part of it. So now, for example, in a digital hospital, how would if I incorporate a digital program or if I incorporate a software program, how would it make my the life of a staff easier? Now, let me take the very simple example of a nurse. Especially in this age of increased accreditations, which is very, very important from a quality standard of point of view because we are dealing with lives of patients. Nurses, often than not, are burdened with more documentation and less time for clinical practice. So, every day I take rounds. I make it a practice that I go for rounds on the floors every day because it gives me a live view of how my people are functioning, how the patients are, how the staff are. So most often what I see is they are just burdened with documentation. So there is this form to fill, there is an admission form to fill, then there is a daily drug dosing chart, there is a vitals chart, and the patient care is compromised. Now for me, if there is a situation wherein my nurse would be able to give more care to a patient rather than being immersed in documentation, that is where it makes a lot of difference to me. That is where, as a digital hospital, I am making a difference in the life of a patient. Similarly, in clinical care, now, for example, a patient comes to a doctor. So the doctor starts seeing a patient. Now, being a doctor myself, for me also, frankly, it is very, very easy for me to just write a paper prescription because you see a patient, you understand, you diagnose, you give the recommendation, and then you see the next patient. But now what happens is doctors are more of, when you slowly transition into a digital hospital, the doctors are also burdened with the additional burden of entering the entire history into an EMR and an EHR. So we've still not reached that stage where a doctor can, without compromising on the time and the effort that he gives to a patient, can easily switch on to a digital mode. So that is where, when you talk about digital, it makes a lot of difference to me. Now, that is the hospital side. Now, you talk about the patient. For a patient, from a service point of view, we talk about, since I've been in hospitals for a very long time, and almost all of you at some point in time would have come to a hospital. You would have either come to the OPD or you would have, either you would have been admitted or some of your family members would have been admitted. Almost everyone experiences this long waiting time in an OPD, right? Even if you take an appointment, say at 10 o'clock, you come at 9:45 also, you'll end up with at least half an hour waiting. Okay, I'm guilty of this because I run hospitals. I plead guilty. But then if there is a system like where, for example, a patient who is a regular patient, right now, for example, if I am a patient, I come to a hospital, I get my doctor consultation done, and in my next visit, the AI triages itself in such a way that, okay, when my UHID is entered, my vitals or my risk factors are automatically fed into the system. That saves the doctor a lot of time, and that saves the patient also a lot of time. So that is where digital hospital, let's not just talk about digital hospital for the sake of saying that digital hospital, where it gives a lot of importance is when it actually makes the life of a patient easier. That for me is what a digital hospital is.
Awesome, Doctor. How many of you know, I don't know, like in India, around 400 million people does not have any insurance coverage, neither from government, neither from private side. A couple of reasons that they don't have the power to buy an insurance. Their daily wages workers, roadside vendors, shopkeepers, and making them experiencing, look, the word experience itself is a big word for them. Healthcare experience. What I always feel, care in healthcare is always missing for them. So over the questions to Bhavijot is that you have told clinics in Bangalore. So if at all anybody is visiting Bangalore, you definitely will see her clinic. You can just walk in, tell her name, get a consultation free. I'm giving that offer. So what I'm saying is that how do you see that the AI is going to upgrade or reaching to the expectations of the experience of customers? You have enough of patient data and that AI experience, what the customers want it, and how are you going to provide it?
I think this is, so one of the things that, like I would like to bring it down to a very simple kind of an understanding for all of us, right? Where will we use AI the most, or rather where in clinic are we using AI the most? That's actually not visible to the patient. The real AI which is being used is in the doctor's room, behind the screen, on the screen behind which the doctor is sitting. Now just think about this. Today, we have 12 clinics in Bangalore, right? And as a company, you would obviously want to scale your clinics and your care beyond 12. How do you go to 1,000 clinics with the kind of variation in the delivery of care which is happening? So if today you just do one experiment, take one medical condition, say you are a diabetic, and go to 5 different doctors, you will get 5 different kind of care programs, right? So the care that exists today is not ready to scale because it's inconsistent. Each doctor have their own way of prescribing, they have their own methods of thinking. But you know what is the most interesting part about medical field is that it is a science. Like any other science, there are protocols, there are evidence-based pathways on how one medical condition should be treated. And it's very much standardized. So how we are using AI in, like from the scale perspective and consistency perspective is that we have a primary care operating system which helps our doctors standardize, use the latest protocol to treat the patient so that the patient gets the best health outcome possible. Secondly, so the doctor is a human, right? So while they are prescribing or while they are diagnosing and doing this consultation, the system tells them the red flags. If they have prescribed one antibiotic with something that they should not prescribe, the system flags it, it becomes red. And they are like, they understand the safety, they understand the concerns, and then they revise their prescription. So it's a continuous learning while they are treating the patient. Now from a patient perspective, how it is helping? You go to a regular doctor, the system today is incentivized to, unfortunately, I have to say this, you are here, but the system here is unfortunately incentivized for higher revenue per prescription, right? You will get more medical tests written, you will get more, not every doctor does that, not every system does that, but majority systems you will see a lot of prescriptions being like heavily flooded with medicines, do this test, do that test. For clinic patients, there are 2 very big advantages. One, even if there is no medicine required for your medical condition, our doctors will tell that to the patient. They'll be like, you don't really need medicines right now. You can just do this and you'll be okay. That means we are not like chasing revenues from that perspective. When it comes to a single patient care, it's all driven by the protocol. If the protocol says no medicine, means no medicine. The other important thing that the patient gets is obviously a continuous follow-up. So once they leave the doctor chamber, right, there is a continuous AI-led follow-ups which happen. So after 3 days, you will get a call saying that, okay, you went to a doctor, this and this was your hypertension measure, have you taken something or the other? So it's all like run by AI. There is no human intervention for us that helps us scale from this current 12 to the next 1,000 clinics that we are going to go to, right? So it's very important to have the care scale. No matter which doctor this patient is going to, they, like age-old family doctors, they will have the context of this patient. They will know that, oh, last time you came, you had this medical problem. 3 times before you had come last year, you had this medical problem. Maybe this and this is happening, right? And it need not be the same doctor because obviously, like there will be attrition. There will be doctors who will go for different things. So we have made using AI a medical agnostic, like doctor agnostic care, so that patients get the best outcome because of the evidence-based protocols that the doctors are following. And of course, the out-of-pocket expenses are saved because they don't have to, pay through their nose the medical bills. So making it affordable for majority of the country.
Awesome. Over the questions, doctor. What do you feel the hospitals after 5 years? How will, as a patient, I will experience the hospital after 5 years?
Okay, so after 5 years, the life of a patient in a hospital, I would definitely say fewer hospital visits because if AI as an enabler, as Bhavjot was saying, is able to triage or is able to predict outcomes or is able to predict the incidence of a disease, right? And you would have a lot more facilities available at your fingertips. Like, for example, you're talking about AI chatbots. So now you put in a symptom, and the AI enables you to give a diagnosis. But then there is, I would say this with a pinch of salt, because end of the day, the responsibility of a patient always lies with the clinician. And unless and until any AI program is justified or is signed off by a clinician, I would not say that we would completely trust it, because in a medical legal scenario, you cannot say that the AI was responsible for my health condition. It is the clinician that's responsible. So any AI program that you take has to go through definite approvals like FDA, and for example, if you take an ECG program, has to be accredited by the AHA and things like that. So 5 years from now, definitely lesser hospital visits, because most of it would be available at your fingertips. More triaging, better informed decision making, both for the patient and for the clinician.
Just a last questions to both of you because of the time limit. How the clinic, the primary care act, not as a clinic, sorry, the primary care in India, the AI is going to change their access.
So, see, I mean, right now, I think there are 3 T's that we talk about, right? The time, task shifting, and also triage, right? So, number 1, time. So, there are so many patients that you see with some of the doctors, right? They have like some of the doctors I know are seeing like 100 patients a day, 120 patients a day. In government setups you go, or you go in like more overloaded setups, right? That's how much time, how many patients the doctor is seeing. So how do you save that time? So AI scribe is one of the very commonly used thing. Now what scribe means is that the doctor keeps talking, and whatever the doctor is talking, this AI is like actually transferring his language into like notes, and very accurately. Like you'll be surprised to see how far AI scribe has come. So I think that is one very rampant use. We have started picking this up in India also. So AI scribe, saving the time, triage. Now government has to do mass scale of screenings, right? Because that's what they do. They run long government programs. That's where they have started using AI. So in diabetic retinopathy, then your X-ray screenings, right? And then also when you talk about TB is one of the use cases where government is heavily investing in AI to see how much screenings can be done. So that's the other thing, triage. And third thing is obviously task shifting. So what is task shifting? It means that, see, we have limited beds in this country on tertiary care level, and when you talk about the complete country, right? You may have more beds in the city, but you will have very lesser number of beds when you go interior of the city. So task shifting means how can you have something which otherwise would require a specialist that a primary care doctor can do, right? So for example, in our case also, you'll see that our doctors can do PCOS related treatments, which otherwise would need a gynecologist. There's so many other conditions which I think not just our doctors, but many doctors across this country will adopt, where a lot of things which would otherwise need for you to go to a hospital or a secondary care, now you can do at a GP level because they have technology to assist them. So what we say is that GP plus AI is equal to, or maybe in future greater than, a specialist in that area, right? So that means that you generally don't have to go to hospital for every single condition. You can go to your neighborhood doctors who will be much more enabled. So task shifting, time, and obviously the triaging. I think these 3 things will change with AI. And they are changing actually. It's not will change, it's happening.
I think just adding the last question to doctor before that, just picking up where doctor has. Earlier people used to Google the symptoms and all, and then you have to find out what is the best answer for me. The chat GPT has come, it has completely changed. You are just asking, you don't want to go up to the hospital, wait in the waiting room, you don't want to wait for 10-minute rushed consultation inside the OPD. So ChatGPT has changed, but I feel the danger is going to come when the customer is completely going to avoid doctor and going to trust completely on ChatGPT. If ChatGPT has told me something, I will only believe. I think the doctor ChatGPT is going to come, so we cannot avoid doctor completely from this. That's it. So coming to the last question to doctor is that the leadership shift, the mind shift. Look, the CEOs are there, amazing. I respect all the CEOs, but I seen in many hospitals is still the traditional old school thought is still there. They are not ready to adopt the technology which is coming, and still not ready to adopt the EHR EMR system itself. Then they are not even able to understand what is ChatGPT, the shift, the customer experience. People don't have patience, even not 1 minute because of the Instagram. So advice is coming from Instagram itself. So what is the major shift the leaders of the healthcare or the hospitals is going through right now? And what do you feel? What they have to do, or they have to upgrade or upskill, or just your opinion?
I think a major shift is basically a shift in the change of mindset that AI is not to replace doctors, but is an enabler. It would help improve your clinical decisions. It will help improve the patient journey. It will help improve the patient experience. And when we were talking about ChatGPT, just a live example that happened in my family. So my wife, so there was a series of procedures that were done in my hospital, very unique procedure, cardiac procedures. So that was in Malayalam, so my wife does not understand Malayalam. So I sent her the clip, the newspaper cutting, and then so she asked me, what is this? Then I told her, upload it on ChatGPT and see what ChatGPT replies. So what ChatGPT eventually translated a life-saving procedure is that a child drowned by suicide. So that's entirely, it's two poles apart. So that's where when we entirely, as you were saying, when we entirely rely on technology without, completely blocking the doctor out of it, that's going to be a danger, that's going to be a disaster. So end of the day, it is always the doctor who has to be at the heart of every clinical decision. AI is an enabler, and AI definitely would help in enhancing the entire patient experience. As the way this talking, like for example, triaging, and kind of recognizing patient conditions. It would help hasten the patient experience and the patient journey. So I think the change in mindset is the most important factor. That you can see that AI is there to help you, not to completely replace the patient.
So my last question is that the context that AI is going to come. Healthcare is going to be personalized, and to get it personalized, the AI will provide more context about us. If I want any ChatGPT, I am pregnant, it will be related to the conversation. But it does not know me. It does not know what is happening on me. Is it a male or female? It's just giving a knowing answer based on the model. I think the AI will definitely going to play a role where it is having context fed, and then personalization is happening. Also the second point is that personalization in healthcare is going to come, and that is a major shift in the healthcare is going to happen, and we are going to experience that change in the healthcare. And I wish from the hospital side, from the clinic side, primary care access, and from my side, I'm also in preventive care, AI, context-led preventive care we are building, and I think we all are going to change some experience in all your life. Take care of your health. Have a good day. Thank you.